Welcome to Chat with Cody. I'm Cody Reynolds, a Democrat running for Congress in the 6th Congressional District of Oregon. Today, I am joined by Andrea Stubbs, a local cardiac nurse and lifelong friend. Welcome, Andrea. Why don't you start by introducing yourself?
Thanks, Cody. It's nice to be here. Thank you for inviting me. Congratulations on running, and I wish you a lot of success. I have been working as a nurse here in the Portland area for the last almost 11 years. I've been a nurse since 2009. Most of that time I've been working as a progressive cardiac nurse, and I also work sometimes as a charge nurse. I'm what's called a relief charge nurse. So some of my days are spent on the floor doing direct patient care, and other days are spent kind of making sure that the floor is taken care of and keeping an eye on what's going on in the rest of the hospital.
Well, I mean, clearly you're qualified to have this conversation, and I'm here to listen to your perspective on the current state of our state from the perspective of an experienced nurse. Why don't we start again? Why don't we continue with how you know me? How do we know each other, Andrea?
Well, I've known you since you were a little boy, Cody, and you've always been very precocious, still very precocious. And we grew up together in Hawaii.
We did.
And I moved to college. Here I went to Lewis and Clark College from 1992 to 1996. And then shortly thereafter started working in downtown Portland at the Imperial Hotel that doesn't exist anymore. And you expressed an interest in coming to Oregon, and I helped you get your first job there.
You did help me get my first job at the Imperial Hotel in downtown Portland. And it was quite the job. Honestly, it was one of the most fun experiences I ever had. It was really an honor to get the opportunity to work with you and then eventually my sister in the same place. So, yeah, we've been friends a long time. We've known each other a long time. And, I've always valued your input and your opinion. And we have had some very, very deep, developed discussions politically and otherwise over the years. And, like I said, I respect you and everything you have to say. So that being said, what is the current state of our healthcare system here in Oregon?
Well, I think everybody knows that this is a pretty difficult time for healthcare, and it's a pretty big question. There are things that were pre-existing before COVID ever hit Oregon that continue to be a problem.
I'd like to interject here. Mm-hmm. So let's talk about those things that predated COVID.
Okay. So one of the things that I know is a huge problem for Oregon is that we actually have some of the lowest, I'm not quite sure how to say this, but we have the least amount of beds per capita in the United States. So even before COVID, we didn't really have sufficient resources to take care of all of the people in Oregon. And that's been massively strained by COVID. So when I first started nursing in Oregon about 12 years ago, you would have lulls where there would be lots of extra space in the hospital, but that's been basically eliminated. For the last 5 years, it used to be in the summer, it would be slower, but we are just like packed all the time. We're utilizing, go ahead.
Is this a capacity problem?
Yes.
Yes. We just haven't built enough hospitals.
Exactly. I think that pre-COVID, we needed probably another entire hospital in the Portland metro area. And obviously it's easier for me to speak about what's happening in the metro area because that's where I work, that's where I live. But my suspicion is that those capacity problems are throughout the state.
So, I mean, I'm not aware of any new hospitals in terms of capacity that have been built in the last 10 years.
The last hospital that opened was Kaiser Westside, and I think that is probably been 9 or 10 years ago. Emmanuel opened Randall Children's Hospital in 2011, and that helped a little bit, but that's it.
So all of the growth that we've experienced over the past 10 years that has led to this seat that I'm running for, has not been accounted for in terms of the growth of capacity needed to accommodate that expanded population, which is interesting. I didn't even know that. Which leads to me to ask this question: what can be done at a federal policy level to address these sorts of issues?
I don't know that I can speak to that, but it seems that there needs to be some sort of planning for this, this continuing population growth. And I think that one thing that could happen in the more immediate future is that we also don't have a lot of infrastructure for people who are pre-hospital or post-hospital. And what I mean by that is that a lot of people don't realize that if you come to the emergency department and you need help, we will help you. However, not everything is going to happen in an acute hospital setting. And so you need home health, you need nursing facilities, you need lots of things after the hospital. And we also don't have capacity there. That's been exacerbated by COVID, like everything has. And so we are not being able to find seats for people who need dialysis. We're not being able to find people who can do home health. And so even more so, people are being jam-packed into the hospital because we don't have anywhere for them to go. We don't have sufficient resources after the hospital. That's kind of a federal policy issue. And the reason is because those kinds of facilities have different requirements about who they take and who they don't take. If you come to the hospital and you need help, we help you. If you need to then go to a rehab afterwards, they are not required to take you if you don't have the right insurance and you can't pay.
I understand. So towards that, I am a huge proponent of healthcare for all. I think that a lot of these problems with regards to people's inability to pay for specialized care that they may need can be solved by the expansion of Medicare, and which in turn could be supplemented through additional insurance coverages for people where Medicare it doesn't feel like enough, But as a baseline, I strongly believe that Medicare should be a baseline of care, guaranteed to all Americans. And the question, I guess, then becomes what resources are available or should be made available to make that happen.
Well, and if I can just go back for a second, the thing that I think is always kind of lost in this whole debate about whether or not everybody should have health insurance is that getting help in the hospital is probably many times the most inefficient and expensive way for that to happen.
Yeah, absolutely.
And so it's very common that you will see somebody who doesn't need to be in the hospital anymore, but isn't safe to go home and can't get into a facility because they don't have the right insurance. They can't pay for it. Those people can spend sometimes months in the hospital in a room that costs $3,000 to $5,000, sometimes $10,000 a day. So it's always mystified me when people think that everyone having health insurance is going to be so expensive, but they don't look at those costs. How much money, how inefficient the system of having people have to come to the hospital for healthcare is. And I think that there would probably be a lot of savings if people did have more of a continuum of care. If they had primary care before they came to the hospital to make sure that they didn't get sick and need to come unnecessarily, and then if they had supportive care afterwards.
Yeah. I 100% agree with you. I think that healthcare is one of those issues where people object to the idea of universal healthcare because they view it as somebody getting something for free, but I think there's arguments to be made for both, from multiple perspectives here that support the idea of universal healthcare. For instance, I think the conservative case for universal healthcare can be made, and my argument from that perspective is that there is an immense amount of human capital that is locked up in the form of people that are stuck in jobs they hate because they can't leave for fear of losing their current health care, because they know that if they leave, their either standard of care will drop or they'll lose insurance completely, or they'll be put into a position where they have to pay for insurance they can't afford because because they can't afford it. And these people who would otherwise be creating businesses, be creating jobs, be creating wealth for themselves and their family, they're stuck in jobs that they can't. They cannot do that for themselves and their family because they can't risk getting sick in that startup phase, in that period where they're not creating wealth, where they're struggling to get a business off of the ground. And there's so many Americans that would love to take control of their lives, but can't for fear of themselves or someone in their family getting sick. I think that's a powerful argument. I think it if you look at it through the eyes of someone who believes in personal accountability, someone who believes that small businesses are the backbone of our country. I also believe both of those things. That's the best argument I can make, for why universal health care why it should exist. That's from the perspective, that's from the conservative perspective. And then I think this is another perspective that maybe gets lost, in that it's the right thing to do. It's from if you have compassion, if you have love for your fellow American, if you care for your neighbor, you should want them to be able to get the health care that they need. I don't see how anybody could disagree with either of those arguments. It's what I think. Where I think a lot of the animus comes from there is that people view things like healthcare as a zero-sum system.
Swimming pool politics.
Swimming pool politics. You can tell me what you mean by that, but what I mean is that because you have, I cannot. Where you're using, or some semblance of jealousy is involved, where, oh my goodness, they have healthcare and they're using it and I can't afford it, so why should they have it and not me? Rather than, why don't we all have healthcare that at least provides us with the confidence to take control of our lives and become the people that we want to become, or be the people we want to be. All right, so why don't you tell me what swimming pool politics means to you?
I will. But I do want to piggyback on that for just a moment. And the thing that I want to talk about as far as COVID goes and universal health care is that I don't think that people really understand that there is going to be a huge burden of morbidity associated with the COVID pandemic. And morbidity is illness, chronic illness. Sometimes it's acute, but it's typically like this chronic illness, because we focus a lot on the numbers of people who have died, which is tragic. There are many millions more Americans who are going to be suffering with chronic illness as a result of their encounters with COVID. I think that they have talked about people as like long haul COVID, but they're finding out that there are some pretty long-term health effects to having COVID, and that's going to affect millions of Americans. And it's probably going to make universal health care even more important, because either you're going to help these people get better, or you're going to leave this huge segment of the population less effective, less efficient, or unable to participate. And that just doesn't seem like a good idea at all. So no. Swimming pool politics goes back to when swimming pools were desegregated in the 50s and 60s. And there were all of these community swimming pools all over the United States, right? And they were centers of the community. People would go there and hang out with their community. Huge thing to do. Well, when desegregation happened, they desegregated all these pools, and a lot of communities in the United States decided to close their pools rather than allow Black people to swim in them. So everybody lost their pool.
Right. Okay.
That's swimming pool politics.
Well, thank you for educating me on that.
Yeah.
So, you've talked about the long-term effects of COVID on the individual and the patients that you're seeing. How about the long-term effects of you and your fellow nurses? How are you guys handling? How do you feel?
I feel tired and discouraged, but more I feel concerned about my patients. And the reason, we touched on it briefly, that I'm a cardiac nurse, and many of my patients, the procedures that they get while they're with us are considered elective procedures. And I think that in the minds of a lot of people, an elective procedure is like maybe you're getting a boob job or you're getting a neck lift. But really, an elective procedure is anything that you will not die if you don't get that procedure immediately, basically.
So non-emergent care.
Well, like maybe you won't get your valve replaced in your heart even though you need it because you're not going to die that day or that week. Or maybe you're not going to get your cancer surgery because your tumor isn't going to kill you that day or that week. So these are very serious procedures that people need. Maybe even if it's not a heart valve or brain surgery that you need for your cancer, it might be because your hip doesn't work or because here's a specific example. This nurse that I work with hurt her knee wakeboarding this summer. And because all the elective procedures had been canceled, she still has not been able to come back to work. That happened in August because she couldn't get an MRI and then she couldn't get her surgery. So she couldn't walk. We're seeing people in the hospital who are sicker, who are dying more often because their care is being delayed. And their care is being delayed oftentimes because the hospitals are too full with COVID patients to be able to take care of people who still need our help. And that goes back to the previous discussion that we were having about capacity. We didn't have enough capacity before. And now you add this burden of COVID and we're really underwater as far as capacity goes.
Well, I'll add my own very personal anecdote to this, in that my father died last year. And you know that. But he died of stage 4 lung cancer. And he'd clearly been suffering for a very long time. But he was one of those men that along with so many other people in this country, got up in the morning and they went to work and they worked the full day and they came home. They provided for their family and they didn't complain. They didn't ask for anything. They didn't take anything from anybody. And he worked up until a month before he died. And he worked till he couldn't stand up. And when he couldn't stand up, my family made him go to the hospital, and they're like, "Oh, you have pneumonia," and they treated him for pneumonia, and they sent him home, and he didn't get better. And he went back 2 weeks later, and they said, "Oh, you have stage 4 lung cancer, and we'll start you on chemo." They sent him home, and he died 2 weeks later. And this is, I think, the underappreciated aspect of COVID is that, my father was a man who didn't want to take anything. He did not want to go to the hospital because he was certain that there were people sicker than him that needed those resources. And there are a lot of people in this country who are delaying care right now that they should be getting because they think, not even that they think, because there are people out there who are in danger of dying and do need that care now. And those people are dying too. And it's going to show up in the statistics for the next, in addition to long COVID, it's going to show up in the statistics for the next 50 years, 60 years. And it's going to be an interesting story to tell from the numbers over that time period. So the morbid, the sad aside, do you have hope for the future of healthcare in Oregon, or for the nurses of Oregon specifically?
The thing that I can say is that I work with a lot of really extraordinary people, and I feel very blessed in my career. I love being a nurse and I love taking care of people. And I know a lot of other people who feel the same way. And so I think that as long as there are people who feel passionate about helping Oregonians kind of live their best lives, I think that there's hope. I feel hopeful. I think that this is a really challenging time for everyone in healthcare. I know that we are tired, and we're hoping that maybe Omicron is the last of these big waves, but we're not confident that that's the case. And we're just going to keep doing what we can do. I mean, that's all that we can do. And I certainly hope that the people in Oregon will make good choices and try to limit gatherings and wear good fitting masks and get vaccinated and get boosted and do everything that they can to help us so that we can minimize this outbreak as best as we can and continue to provide quality care to people in Oregon because we deserve it. We're all Oregonians.
I 100% agree with that sentiment and that statement. So in the interests of providing the best possible care to all Oregonians, have you seen any innovations that have come or arisen out of this pandemic? I mean, there's been this explosion of this concept of telemedicine, but I mean, in terms of policies, procedures, anything that you're seeing at the ground level, you're at the front lines of this, and you see, what are you seeing?
I don't know. I mean, I do think that it's been amazing to see how people have adapted and found different workarounds and ways to like still see patients and still take care of patients, even though we don't have all the resources that we need. I have been impressed with the coordination between the hospitals in Portland. I think that Emmanuel's done an amazing job. I think that OHSU has done a really good job. I'm sure that Providence is in there too. Working together and kind of sharing ideas and technology. But mostly I think I haven't seen a lot of groundbreaking technology, but I've seen a lot of adaptability. I've seen a lot of people being ingenious in the ways that they problem solve.
That's, I mean, it's good that people are staying flexible, both, physically, mentally, adaptable to this pandemic. I too hope that Omicron is the peak of this last 2 years worth of sadness in terms of this national tragedy of we are literally every day losing as many people as we lost on 9/11 21 years ago. And I think that if people are failing to realize the scope of what's going on, I hear people making fun of I hear them making fun of this of COVID, calling it the pandemic, calling it a flu. But, clearly you have been a nurse for the past 11 plus 12 years now, and you have never seen a flu season like this.
No. And I was around for H1N1 when everybody was getting sick. That's nothing compared to this.
That's nothing. I mean, in terms of scale, if you had to compare it in terms of scale.
Oh, you can't compare it. And the thing that I do want to say too is that I know that it has been discouraging for people who are vaccinated to feel like they're still getting COVID. But from my perspective, I can tell you very clearly that the people who we take care of where I work are too sick to be on the floor, but they don't need to be intubated in the ICU. So a lot of them are what's called high flow nasal cannula. And almost without exception, I would say that the people who are on my unit with COVID are unvaccinated. The exception to that is people who are immunocompromised, who maybe have a previous history of cancer and aren't able to mount an effective response to the vaccine because of their compromised immune systems. But other than that, we don't get vaccinated people who need to be on high flow nasal cannula. I know that that can happen occasionally. I'm not saying that it's impossible, but clearly being vaccinated and being boosted makes a huge difference in how sick people are getting. I think that would carry on to the ICU too.
I mean, it would make sense.
Yep.
And it really is sad that so many people are dying, preventable deaths.
Needlessly.
For pride, for ignorance.
I think, people who are not vaccinated, I understand that they're not a monolith. I think some people are just really afraid. I think that unfortunately they don't have access to reliable material, or they've been influenced by their friends, among other reasons.
Right.
I do hope that if you're not vaccinated, it's something that you will continue to think about, continue to consider, look at reliable data, and protect yourself, protect your family, protect the people that you love. Everybody has vulnerable people in their lives.
Well, I mean, it's worth noting that even our former president has now said that get vaccinated. It will keep you alive.
Yep.
I mean, that's something coming from that.
And it'll keep the people that you love together.
Yeah.
I mean, most people have a grandma or a child under 5 or someone in their family that they care about and want to protect. And getting vaccinated is to protect yourself, but it's also to protect your community and the people that you love.
Well, I agree with everything you've said. And, over the course of our friendship, we've had our disagreements, but most of the time we come to common ground. And I've appreciated this conversation and your time, and I want to thank you again for coming on this podcast. It was a pleasure.